We now inaugurate CannaCosta 2015 with the presentation of the Executive Director of the Costa Rican Institute on Studies for Drug Intervention. He has a master's in mental health of the Miguel Hernández University in Valencia, Spain, and he will be talking about human rights of people that use drugs. Let's please welcome Mr. Ernesto Cortes. In the Costa Rican Association for the Study and Intervention on Drugs, which is quite a new institution, we've been working on how to introduce human rights into policies on drugs. When we talk about regulation of cannabis for medicinal use, we are talking about policies on drugs. We're saying how will the state decide to control and regulate production and commercialization, later on sale and consumption. And how some people are affected, whether negatively or positively, with these regulations. From the time when humans started getting together and living in groups, and probably even before when we had substance use. Here we have some from Africa, Peru, Egypt, Mexico, Central America, and India, where substances were always present, but they were present in spiritual and religious contexts, even medicinal ones as well, and even political. In these historical times, it was really difficult to separate such uses. Many times we had the shamans, the leaders of communities, deciding and using these substances, and they made the decisions for the groups and the whole society with their trip or hallucination. So how drugs have always been present. Slide showing you the very clear differentiation and uses. People know why they use it. They want to feel more energized, sometimes even socialize. Or marijuana in like the Dutch style, rolled up. Down here, we see medicinal use, or medications, if you will. When did that change happen? When did we change from a medicinal use or a non-medicinal use? So although there is a whole process before the international conventions that we have as part of the drug control internationally, we have a change with these conventions. Basically, the Convention on Narcotics, which would seek for states to regulate the production, commercialization, and use only for scientific or medicinal purposes. All uses that are not for such purposes are non-authorized or even illegal. There's just certain uses that are allowed, and we might ask ourselves why only are just allowed, but there's some drugs that don't have medicinal potential, and they have a potential for abuse. The Single Convention on Narcotic Drugs of 1961, it lists the ones that are more dangerous on lists 1 and 4, and cannabis is on list 1 and 4. Cocaine, for example, is just on list 1. Of course, this is from 1961. Undoubtedly, it is a bit dated already. But then we have another convention of 1971 that includes psilocybin. And the latest we have from 1988, which leads states to say that that production and commercialization should be criminalized if it's unauthorized. Just to clarify some of the levels, we have a graph here based on research by a study group in the UK determining the most harmful drugs. The methodology is a bit difficult. It's not easy to say which drug is more harmful than the other. But in this effort, they also tried to look at the international lists for drug control and to see which ones were more or less hazardous. The first two are illegal drugs. Then we have one that is low risk, barbiturics, which are prescription drugs, alcohol and ketamine, that are regulated for overaged adults, and others. So this is just to give you a context on the international control on drugs. And again, it is out of date based on international conventions and treaties that have to be revised. Actually, next year there will be a special assembly in the UN that is vitally important in this case. This will be the special session on drugs, UNGAS, that will open up a portal for states and governments to say and decide whether they want something different, or we have to consider that there's other international agreements. And it's always the argument, are they above the others or not? And again, these are all UN conventions, UN agreements. We have all the different ones on human rights. We also have some regulations in Costa Rica. We regulate that. Of course, we adhere to international conventions on drug control. And because of that, we can see Article 126 of General Law of Health, that includes another article as well, that says that it is forbidden and subject to destroy the cultivation of opium, coke, or hemp or marijuana, and any other plant with similar effects. It is forbidden to import, export, traffic, or use these plants, even their seeds, if they are about to or have the capacity to lead to a plant. These are the three base plants of the single convention, are also prohibited for any use. The law on psychotropics, as we call it here, changes it a bit because it really puts into practice the conventions. And here we differentiate the behaviors that are non-legal or that would lead to be considered as a crime based on Article 58 of the law. It says anyone who distributes, sells, prepares, refines. I just put it here just for you to see that we don't have consumption. The word consumption is not there, and that is what I wanted to highlight. And Article 79 says that they will promote and facilitate voluntary use and therapeutic use. So the use or consumption of drugs is not criminalized. It's not sanctioned criminally. And this is important if we compare with the rest of Central America. Here we have a chart where we have regulation on consumption. A person in Nicaragua with 5 grams of cannabis or 1 gram of other drugs can receive up to 30 days jail time. If it's a second time, 30 to 90 days, and there's also an economic penalty. The same in Honduras, El Salvador, and Guatemala. So Costa Rica is the only country in Central America where use is not criminalized. This is very important because criminalizing use makes people turn away from the possibility of looking for health services or leaves them out of that, even out of labor opportunities. Here we have a report on the OAS. I recommend everyone to look for it. It is from 2013, The Problem of Drugs in the Americas. And there's another report on scenarios of the possible ways that American states can use to work on this topic. It says, as far as consumption of drugs is penalized or stigmatized, vulnerable populations will not be able to seek timely information, public health services, and overall prevention and treatment programs. So if a kid in high school is expelled because they are using marijuana, they are out of educational opportunities. They are excluded. Or a user of cannabis, if they go to jail because they have plants for personal use, they have opportunities closed up on them. Because of the way our jail system works, they don't really reinsert people. They deculturize them. And the even UNODC has mentioned that the decriminalization of consumption, it may be a good way to have our jail and prisons not so overcrowded. The right to health is really the one that helps us work in the context of decriminalization. If consumption is not sanctioned criminally, how do we control it? Because the state always controls. Should it be stronger or lighter in terms of its control? So internationally, right to health is the right of every person to enjoy the highest level of physical, mental, and social well-being. And the protocol of the American Convention on Rights, on political, cultural, and economic rights of San Salvador mentions the importance of the state and primary care, the benefits for health care, preventing endemic disease, education, and just fulfilling the needs of everyone's health. And there's also a report on Anand Grover, the Special Rapporteur of Rights, on the right to health and drugs, presented in the Council on Human Rights in 2010, mentions that international conventions should also do that. Conventions referring to health should seek to ensure that benefit or that possibility of people accessing these healthcare services. And if these services are medications based on a product that is internationally supervised, well, the same applies there. In Costa Rica, we have the same. We also have a lot of legislation in terms of health. And trying to guarantee these rights, at least on paper. The general law on health, we have 4 full articles there on the right to request healthcare services, the need for the state to reinstate or to take care of the health of its citizens, and its duty to do so, the therapeutic use for elements that are necessary to treat disease, and even treatment for people that have problems with consumption or have some kind of dependency. The law on drugs or psychotropic substances also mentions this. So you can do it. The state can guarantee, at least legally, these types of rights. So they also have the matter of access to essential medications. The need of people all over the world that, due to certain illnesses or sufferings they have to access to medications, basically opioids, whether synthetic or plant-based, because these are the medications that have usually been used to control pain. In some countries, this possibility of access is very restricted. So now we come to the right of these people to access and have a better quality of life through their access to healthcare. These are all quotations from the Special Rapporteur's report on the convention I mentioned, and it says millions of people all over the world need essential medication for treatment of pain, drug dependency, and other health problems, but it's frequently restricted because of regulation, and there's not a good distribution system and not sufficient capacity in the healthcare systems. There is kind of a fear of these medications deviating from that use. Of course, we have to prevent that. Undoubtedly, we don't want to have a non-medicinal use. But then we also come into the matter of when is it non-medicinal? When is it purely medical or sanitary? Here I have an example of a woman planting. How can we guarantee these people access to a substance that works for them, out of fear that it might be used in other contexts or out of fear that it might be misused? There could also be misuse of pharmaceutical medications and others that are sold in drugstores and through the healthcare system. It also has to do with the right to self-medication. If we're talking about cannabis, the right to self-grow and the right to have free access to a substance that could work.
And this is quite important because in the end it's about people. What we care about are people who can have proper use. They can make good use of this substance. It could be medicinal, recreational, spiritual substance, if you will. There are many names, just names, because these people have rights regardless of their different conditions, and the state should be the guarantor of these rights. And what is the response, the answer that the state, the government must give? Well, the guarantee and protection of the rights. So we have a campaign, and I plug in a commercial. It's a global campaign. It's called Support Do Not Punish. Right now it's in over 100 cities around the world. And what we're trying to do is to promote drug policies based on human rights and public health. And we have two or three messages, if you will. What I've been saying: people who use drugs should not be criminalized. Consumption or use is not a criminal issue, it's a social policy issue. And another topic that has to deal with it, which is trafficking, which is a crime. Well, that would be those people that are at the lowest echelons of drug trafficking. Most people in jail are in jail because they were transporting or selling small quantities. I mean, they're not the big fish. They're not the ones handling the criminal organization. And the punishment does not fit the crime. And we have a lot of women in jail because of this. Over two-thirds of women incarcerated in Costa Rica is due to drug trafficking in small quantities, by the way. And now here, marijuana cultivation or planting marijuana can get you to jail just because you want to grow your own plants. Just growing them. I mean, you can consume them, but you cannot grow them. And at least 10% of the budget for drug policy should be to damage reduction, which is a focus introducing human rights in the policy associated with drug use, based on the person, what the person needs. For example, if an individual says, okay, marijuana is better than using crack, so I'm using marijuana to stay away from crack, well, you could see that. Or I don't want to quit drinking so heavily, cold turkey. So we'll go step by step with another substance that can help you. So let's try to build together with them their own healthcare process, their healing process, and their quality of life. Because repression, prohibition, and criminalization per se aren't working, have never worked, they're worsening things. Thank you.